welcome back. We have Dr. Wang Teng here on behalf of MemorialCare Saddleback Medical Center. Well, welcome. Very nice to have you back. It's been a while.
Thank you, Lisa. Good morning.
Good morning. Now, you handle quite a bit. You're a vascular and endovascular surgeon, and you are the medical director of peripheral vascular services at Saddleback Medical Center. So tell me a little bit about your job.
So, Lisa, thank you for having me. It's been many years since I was here last, but as a vascular surgeon, I take care of diseases of blood vessels, vascular, of arteries, veins. There's also lymphatic system, swelling. And I'm the medical director of vascular services. I take care of the administrative stuff for clinical affairs at our hospital across the street.
Okay. Now, tell me a little bit about how you arrived at this point. You've been a surgeon for how long, and where did you go to school?
Yeah, so graduated locally, UC Irvine.
Okay.
Actually did 15 years at UCI,
Gotcha.
So outside of high school. So undergrad, I did some research work with UCI medical school, and then general surgery and vascular training. And then first job, career outside of training was here at Saddleback, back before the name change. And have been here ever since, taking care of our friends at the Laguna Woods Village.
Okay, so you've always been this particular arena, right?
That's correct.
Okay.
Yeah.
Was there anything in your training or happened in your family that got you to this point? Because sometimes people have a story.
That's a great point. No, so for me, it's, we start as general surgeons.
Okay.
And vascular surgery is a subspecialty of general surgery.
Okay.
And so as general surgeons, you continue on as a general surgeon and continue to do the bread and butter of general surgery, or become a specialized surgeon, as I did, and go through the technical intricacies of vascular surgery. And we find that very interesting, and taking care of some pretty technically difficult to handle disease, which is artery disease.
Right.
And fine operations and such. And so I find that as a challenge, and really enjoyed it for the breadth of my career.
Are you using robotics for a majority of your operations?
What a great question. Yeah, so robotics is not big in vascular surgery, as it is in other specialties like OBGYN, urology, general surgery, and such. And so I think vascular surgery will eventually get to using robotics, but rather our big thing is what's called endovascular. And so we talked about that a little bit earlier as a vascular surgeon and endovascular surgeon. What does endovascular mean? Is that we manage blockages in arteries by using little balloons and stents.
Right.
And hopefully we can talk about some of those things today as one of our procedures. So endovascular is our minimally invasive way of doing operations, just as robotic is for those other specialties.
Okay. So would you say the majority of the patients that you treat do use one of those particular things that you mentioned, either a stent or a balloon?
That's right.
Okay.
Yeah, so the majority of our treatments now are minimally invasive.
That's great.
Using endovascular techniques.
We'll look at that in just a second, but I wanted to ask you a question. How many balloons or stents can one person have?
So the balloons are something that goes in and then is removed.
Oh, gotcha.
So the balloon is actually a tool to stretch open, crack open, break through blockages.
Okay.
And then the stent is the implant, the lattice, the wire mesh tube that is actually left in place.
Okay.
So in theory, you can have stents all throughout every vessel in your body. It's quite costly, but there's no limit.
I only ask because my father's 93 and I think he has 3.
Yeah.
And so it seemed fairly common that for you to be able to treat it and help them breathe and help them have the blood flow that they need. So let's actually talk about this particular type of operation that you guys do. So it's called TCAR, T-C-A-R.
That's correct. So TCAR is an abbreviation for a transcarotid artery revascularization.
Okay.
And revascularization basically means to open up the blood vessel again. Yeah.
Okay.
And the reason why we would offer this type of procedure is that carotid arteries become blocked over time. It's part of the aging process and is accelerated by those with high risk factors.
Right.
Smoking, number 1, diabetes, number 2,
right.
high blood pressure, cholesterol, diet, obesity, and such. And so with these blocked arteries, they can cause strokes. And so that's the big deal of what we're trying to do, is prevent strokes.
Okay.
And by preventing strokes requires an operation of which the transcarotid artery revascularization, or stenting, as we would just call it, is one of the options that we provide here at Saddleback.
So how has this changed over the years? Because you are referring to it as a fairly new option, but how long has it been around?
That's right. So stenting's been around forever, right? Just as you said, your father, who's had stents placed in other organs, right? Mostly in the heart. We place stents in the legs.
Okay.
We can put stents in your lungs. We can put stents in your intestines. And so there's stents, those wire mesh tubes that I just talked about to hold something open, are in place for many years.
Okay.
Today, we're putting stents in to open up blocked arteries in the heart, we know about, in the legs that I do. And then we also have placing stents in the arteries in the carotid that go to the brain. What is new about this procedure is these stents normally are placed through punctures in your groins.
Okay.
However, now we're stenting the carotid artery in your neck through small incisions at the base of the neck.
Oh, interesting.
Correct.
So how come you had to go so much farther away before?
Right. So that was the access point, right? So that was a common access point to get inside of your blood vessels in the heart and other parts of the body, which are the groin arteries, your femoral arteries. The problem is placing stents in the carotid artery has a pretty high risk of stroke, of giving you a stroke during the operation. So wait a minute, you're trying to do an operation to prevent strokes, but yet the operation carries a pretty significant risk of giving you a stroke. So that was not an ideal approach through the traditional way, through your groins. And so what has been developed by this company, Silk Road Medical, pretty groundbreaking, is delivering that stent through an incision in the neck, number one. Number two, having a system, and I think we have another slide on that potentially, in which the artery, and we'll see in the top left of the screen there, in which the artery now flows backwards. You force the artery to flow backwards, such as while you're working on that artery, as you're placing a stent on it, such that if you disturb any plaque, that plaque doesn't travel up into the brain and give you a stroke.
Interesting.
Rather, it travels backwards, and we dump it into a vein, in which doesn't cause
So do you have like a little tube?
There's a little tube that goes across the area that we work,
Okay.
travels across the body, and then goes into a vein.
Sure. Wow, that is amazing.
So that's the difference.
Huh. And that's only been around for how long?
It's been around 4 years.
Okay.
I was the first to place it here at Saddleback.
Oh, okay.
As well as my partners, Dr. Sharma and Dr. Deering.
Oh, that is fantastic. Well, you know, and like you mentioned, it's such a lesser risk for someone. And do you choose to do it on certain kinds of people, or do you just go ahead and use it on everyone?
Great question, Lisa. Thank you. So this is weighed against our traditional operations. Our traditional operation is what's called a carotid endarterectomy. That's the good old-fashioned incision on the neck, shut the blood flow off from the brain temporarily, open up the artery, and then take that plaque out. And that operation carries its own risks: bleeding, infection, nerve injury, giving you a stroke. And so those are the two operations that we would offer you, either traditional open surgery, carotid endarterectomy, or this stenting procedure, both of which carry the same benefits of stroke prevention.
Okay.
The TCART procedure carries a less surgical risk, smaller incision, same recovery, and similar risk of giving you a stroke during the operation.
I see. I see. Interesting.
Yeah.
And you can learn all about this if you are attending the Health and Wellness Expo that you guys are going to be presenting at. So tell me, you have a booth? Or are you going to do a talk? What will it be?
Yeah, so we will be at the MemorialCare booth, Health and Vascular Institute, myself, and my cardiology and interventional colleagues will be there.
Okay.
We'll be talking about vascular disease from head to toe.
Okay.
Cardiologists will talk about their heart disease and lung, and I'll be talking about vascular disease.
Okay.
We've got blood pressure screening.
Okay.
We have dietitians there that will talk to you about making good choices in terms of diet, and we'll be happy to answer questions regarding carotid disease, the stenting procedure, and such.
Will you have the samples there, maybe?
I will have little handouts.
Okay.
Yeah, and maybe I'll bring a stent or two.
Well, sometimes I think it's interesting to see, how small
Exactly.
they are, so people don't get kind of worried,
Deal.
So
I'll bring it.
Okay, so great. So he's going to have that just for you guys because I asked. So I love it. Thank you so much for the information. I really do appreciate it.
Wonderful, Lisa. Thank you for having me.
All right. If you want more information about anything that we have discussed or you have questions, please go to memorialcare.org/SB Heart. And don't forget, they will be at the Health and Wellness Expo on Saturday, March 25th from 10 to 2. We'll be right back.